September, Texas hospitals and other providers must provide patients with an itemized bill before any attempts to collect money. It's the result of Senate Bill 490, filed by East Texas State Senator Bryan Hughes, who tells us legislation like this just makes sense.
Many times you're leaving the hospital, you're ready to get home, you're concerned about your health, when's the follow-up? The last thing on your mind is asking for details about the bills.
And for that reason, State Senator Bryan Hughes authored legislation requiring transparency when it comes to medical billing in Texas. Legislation signed into law last month by Governor Greg Abbott. The bill not only requires patients receive an itemized list of services, the descriptions must also be easy to understand.
Many people may have had the experience where you look at the bill later and you're not clear exactly what it's for, what the charges are for. Maybe it's a provider you don't remember seeing. Maybe it's a service that you don't know you received. So having a simple, clear explanation is going to make a whole lot of sense.
Hughes worked on the bill with House Rep Caroline Harris of Round Rock, who worked for Hughes during the last session when they tried and failed to push the bill over the finish line.
Got through the Senate, but then got hung up in the process, and so we came back this time.
Among the forces against the legislation this session, the Texas Hospital Association, which argued itemized bills would be costly for hospitals.
We have concerns with the bill as filed, potential confusion for patients, our inability and our challenge to operationalize, and the expense to accommodate the proposed changes or issues for us. Less than 2% of our patients request itemized statements. Itemized statements can be as minimal as 2 pages for outpatient services or hundreds of pages for higher acuity inpatient care.
And while the number of pages may have been an original barrier, the finalized Senate bill does allow hospitals to provide statements online using patient portals.
It's remarkable a bill like this would even have opposition. It seems pretty common sense, but believe it or not, there are forces in Austin that don't like the idea of transparency and accountability. So we're very thankful the bill got through all that and has now become law.
And that bill did receive bipartisan support in both the House and the Senate, with a total of 126 co-sponsors. And while the legislation has already been signed by the governor, it will not take effect until September 1st. Disciplinary action can be taken against providers who failed to provide those itemized bills.